Hi everyone, you're listening to a special episode created by two programs supported by the Ontario Brain Institute. I'm Wagdan Abdelmomen, the Knowledge Translation Coordinator at CanBind, which stands for the Canadian Biomarker Integration Network for Depression. And my colleagues are from EpLink, the Epilepsy Research Program of the Ontario Brain Institute. So as you can probably tell, our focus for today will be on depression and epilepsy. This brief podcast wants to give you a sneak peek into a free webinar we will be holding that delves into why depression can happen in people living with epilepsy, what to do about it, and busting some myths about treatment. I'm happy to welcome Dr. Elaine Kiriakopoulos, who is an assistant professor of neurology at the Geisel School of Medicine at Dartmouth and the director of HOBSCOTCH Institute for Cognitive Health and Wellbeing at the Dartmouth Hitchcock Epilepsy Center in the US. So thanks for joining us, Dr. Kiriakopoulos.
Oh, it's great to be here with you today, Wagdan.
Great. So today we will ask four simple questions. How prevalent are mood disorders in those living with epilepsy? Why do they happen? What preventative options are out there? And finally, what is treatment for depression like in people living with epilepsy? So, let's start with the first. Dr. Kiriakopoulos, how common are mood disorders and particularly depression in people living with epilepsy?
Great, sure. So I'll start by saying that similar to people with any chronic disease, people with epilepsy are at higher risk for mental health issues, including mood disorders and psychiatric comorbidities like depression and anxiety. A sizable body of clinical research evidence supports the understanding that psychiatric illness is overrepresented in epilepsy as compared with other chronic medical illness. It's been shown that this overrepresentation of psychiatric illness is significant both in adults and children with epilepsy. Mm-hmm. Now, what I'd like to share is that it's important to remember that epilepsy journeys will vary for every person. Mm-hmm. But we know based on prior population studies that have been done in several countries, including Canada, that roughly between a quarter and a half of people with epilepsy will also be diagnosed with a mental illness. And this means that the problem is both complex and common, and depression and anxiety disorders being the most frequently present, with lifetime prevalence rates ranging between 30 and 35% in population-based studies.
So the numbers you mentioned there are quite significant, and I'm curious about why, or what are the theories out there that can explain this overrepresentation of psychiatric illness in people living with epilepsy?
Sure. If we look more closely at depression, the bidirectional relationship between epilepsy and depression is really well established. So, in fact, 26 centuries ago, Hippocrates expressed melancholics ordinarily become epileptics and epileptics melancholics. And what this means is if you have symptoms of depression, you're more likely to develop epilepsy. And if you have epilepsy, you're more likely to develop depression. And so 26 centuries later, this observation has been confirmed in several studies, demonstrating that patients with epilepsy have a 5 to 24-fold higher risk of developing depression, and that patients with depression have a 2 to 5-fold higher risk of developing epilepsy. So there is a bidirectional relationship which exists between the two conditions. Now, the precise biology that underlies this bidirectionality is still being studied, but this increased risk has been demonstrated in clinical studies.
Mm-hmm. Mm-hmm. So you mentioned a bidirectional relationship and, up to 5 to 25 times higher risk for depression in those with epilepsy. If I can just want to ask a little deeper into that question, are most of the theories related to like a brain level of neurochemistry that's associated with it, or are there other social factors that could increase the risk of depression in those living with epilepsy?
So I guess you're trying to get a little bit at cause.
Correct, yeah.
We don't completely understand the biological mechanisms of the comorbidities. And, this is an area of research that's ongoing, and it requires and deserves much more study. Now, one thing to consider is that there's a spectrum of depression and also many different types of anxiety disorders. And when it comes to relating these to epilepsy, the most frequently recognized depression or anxiety episodes occur independently of the occurrence of seizures. And they're called interictal episodes, meaning they're not related in time with seizure activity. And they can occur anytime, whether a person has been seizure free or not. Now, there are also symptoms of depression and anxiety that are related time-wise to the occurrence of a seizure. And we label these periictal symptoms. And in this case, symptoms can occur before a seizure, what we call preictal, or after a seizure, postictal, or sometimes the symptoms can actually be the manifestation or the expression of an actual seizure. And, it's important to think about the fact that a person can have both interictal, so not related to seizure activity, and periictal, related to seizure activity, symptoms of depression. And a key reason really to try to understand the timing of symptoms is because the treatments would vary. For example, if someone has a different underlying cause not related to seizures, then the choice of an antidepressant medication may be very helpful. But for someone who has ictally related symptoms, they may also see improvement with improved seizure control. And so understanding the causes of epilepsy and comorbid depression can be complex. And so multiple factors really have to be considered when it comes to thinking about mood disorders in people with epilepsy. And some of the frequent considerations, aside from those that I've just shared, begin really right back to the way some people may respond to being diagnosed with epilepsy. And so by this, I'm talking about the way a person reacts to being given the news that they have a seizure disorder. As you know, can bring with it a real unpredictability, particularly if seizures are difficult to control. And for some people, that means new restrictions on their lifestyle, a change in independence for some, restrictions like not being able to drive, certainly the fear of having seizures and injury and death for some people. People worry about that. And then there's this overarching area of stigma related to epilepsy, which we know can be pervasive and debilitating for some people. So the adjustment phase can also contribute to mood disorders in epilepsy and requires support, ensuring people are well supported during this time and providing them with education and a sense of understanding of their diagnosis is very, very important. Now, another consideration is risk factors associated with a person having a family history of mood or anxiety disorders. And so if someone with epilepsy has a first or second degree relative that has had psychiatric disorders, they may have elevated risk. Also, abnormal structure or function of certain regions of the brain, and in particular, the temporal or frontal areas of the brain, we know can be more involved with depression. And then at a synaptic level, so where the brain cells communicate, we know there have been links to altered expression and action of certain neurochemicals or neurotransmitters as well.
So I think that was a very comprehensive response. And just to summarize some of the things I took note of while you were speaking there, is it to consider there are various considerations when thinking about the cause of mood disorders or mental health issues in relation to epilepsy. And that one includes, risk factors, but also the adjustment to the diagnosis and adjustment, I'm assuming also to treatment and that process. And furthermore, considering the symptoms that one may experience between episode or between seizures and also around the time of a seizure. So that was a really comprehensive response, and it segues really well into my next question, which is prevention. We have listeners today who may be living with epilepsy or know somebody living with epilepsy and want some general tips or ideas on how to optimize or enhance mental wellness in a person living with epilepsy.
Sure. And, you actually mentioned something really important about treatment, and I didn't yet touch on that. So I will, because it sort of traverses both cause and prevention, working together. So the effects of treatment for seizure disorders are also really important for people to consider, both pharmacological, so like medication, anti-seizure medicine, and surgical treatments for some people can contribute, particularly if they have a predisposition to mood or anxiety disorders. And a key point really to emphasize here is that if you're someone who's experiencing symptoms related to depression or anxiety with either the initiation or the discontinuation of a medication for your epilepsy, it's really important that you share that with your medical providers, because it's important for them to know about these symptoms so they can work towards alleviating them. And that may be something as simple as a dose change, or it may require a medication change, or it might be found in evaluating that the anti-seizure medication is not related and that there's some underlying mood disorder that requires additional treatment. And so when we think about treatment and prevention, they go together. And I can't emphasize enough how important it is for people to surround themselves with a medical team that they feel comfortable communicating with around these tough issues, including discussing mental health symptoms.
So you mentioned, if you do experience symptoms like of depression or of anxiety or anything else in the mental health sphere, to let your provider know and to also surround yourself with a team that you feel comfortable sharing these issues with.
Absolutely.
Any other points generally for improving well-being that you can share with us today?
Sure. I think, another thing that people and their loved ones can do is really be educated and able to recognize the symptoms and signs of depression. So some of the common things that people experience with depression are isolating from others, poor sleep, or for some people, excessive sleep, losing interest in their personal appearance or hygiene, excessive crying, being angry all the time, or feeling unable to make decisions, feeling a sense of worthlessness in some of the more severe cases. And so aside from being able to communicate, to recognize these things and communicate them to your medical team, being aware to ask for a referral to behavioral health services can be very, very important. And then in addition to seeking the appropriate level of medical care, thinking about support groups that are often offered at epilepsy centers or through community serving epilepsy organizations can also be a tremendous benefit to people. Finding support through recreational activities is helpful for some people. For others, they find it helpful support-wise to be involved in their communities of faith. Also important in general is keeping tabs on general health practices. So things like getting enough sleep, working in some regular physical activity, ensuring good nutrition, all of these things which impact overall health are important as well. And we know that finding ways to manage stress is also helpful because we know that stress creates certain hormones related to the nervous system that can impact the brain. And stress can also cause sleep issues, which can then result in triggering seizures. And it's well known that chronic stress can lead to anxiety or depression. And so at the same time, being anxious and depressed can worsen stress. And so this can cause a vicious cycle with more seizures and mood problems. So targeting stress, it can help to prevent this type of cycle from occurring. So that's an important part of the conversation to have with your medical team too. If you recognize that you're feeling stressed or that you have more stress in your life, working with them to find ways to relieve stress is really important.
That's really wonderful. So you mentioned recognizing both the symptoms and recognizing stress and seeking help, being able to talk to your team, but also getting the support from the community. And it's really good you brought that up because in our webinar, part of it, we'll have a speaker share about local resources that one can refer to if they're living with epilepsy and they need that support. So we'll definitely go into that further in the webinar. And basically my final question, and you've really covered a lot of it, is related to the actual treatment. So if one were to receive formal diagnosis of depression or anxiety, for example, and they are just thinking about their options for treatment. You'd mentioned medications. You also mentioned psychotherapy. Could you give us a quick overview of what to expect if one is regarding the two different arms of treatment?
Sure. When a person is diagnosed with depression or anxiety, there are certain recommendations that exist that guide treatment. And those include, for a person, say, with mild depression, to consider beginning with psychotherapy or psychoeducation, because we know that these techniques can be very, very effective at helping people. And then there is antidepressant medication as well, which you've referenced. And it's important to get a good evaluation from from a behavioral healthcare provider, someone who can work with your neurologist or your primary care physician to make recommendations around antidepressant therapies, which can be very, very helpful. And I want to emphasize that it's safe for people to take antidepressant medications if they have seizures. There's some sort of lingering myths out there that it's not safe, and it's safe for both adults and children. And we know that by treating these comorbid mood and anxiety disorders, people's quality of life improves. And for some, even their seizure symptoms improve. So it's safe for people to take these medicines. They're selected carefully with the knowledge from a behavioral health provider and your neurologist. And people definitely benefit from having, this treatment instituted early.
Thank you very much for bringing that point up. And like you mentioned, there is, sort of an idea that antidepressants, or specifically things like SSRIs, which are the most commonly used antidepressants out there, they're not safe in individuals living with epilepsy. And so I think I'm both among people living with epilepsy, but also among some clinicians who don't commonly work with people with epilepsy. And so it's really good that you brought that up. And so, okay, so I think we're reaching the end of our discussion today. I'd like to sort of wrap it all up by asking you to share with us one or two take-home messages for our listeners today, whether they be people living with epilepsy or loved ones or even clinicians and researchers. What do you think our listeners today should take away from our conversation?
Sure. I'll start by saying that based on what we know, it's pretty clear that people with epilepsy are at a higher risk for depression and anxiety, along with many other psychiatric disorders. And so it's important for people themselves and their loved ones to be able to recognize the symptoms. It's important for providers to screen patients and to talk to their patients about mental health when they see them during their visits. And there are good screening tools available to help identify people who are struggling with those symptoms. And then it's really important to connect people to the right level of care, whether it's a mild depression or a severe depression, to think about whether psychotherapy or antidepressant medication is going to be the right choice and what level of a continuum of care might that person need. And, working to keep the communication pathway is so important. And I know I've emphasized that today, but a lot of these symptoms, as we talked about, can be related to seizures. So being able to share that information with your provider, or they may not be. Someone may be predisposed to a mood disorder and they may have a history of a mood disorder that comes even before their diagnosis of epilepsy. But we know there's this potential for a person with epilepsy to have a higher risk for it to occur, and that there's this bidirectional relationship. So communication between the person living with epilepsy, the support of family members, and the awareness about this potential is really important. And then the ability to share those symptoms freely with your providers and get connected to the right care. And that can be medical care, but also support services. And, support services can include some of the things we talked about in the community, but they can also include adjunct programs that are evidence-based specifically for people with epilepsy. So there's a whole menu of managing epilepsy well programs that were developed with funding from the CDC that target comorbidities in epilepsy. There's one specifically that targets mental health called Uplift, and people can, get connected to that program at no cost. Our work at Dartmouth has been around the HOBSCOTCH program, which is focused more on cognitive symptoms, but certainly frustration with cognitive symptoms can lead people to feel more depressed and anxious. And both programs have an element of CBT or mindfulness as part of those programs. And so people can connect to those programs by, going to the ManagingEpilepsyWell.org website and linking to them. So those kinds of adjunct programs can be very, very helpful for the person living with epilepsy and also their family members. So I do want to mention that.
That's really wonderful. Thank you for mentioning the resource. We'll certainly be sure to have the link active for our listeners because we will have a written version of this interview as well. So in summary, I think I picked out three main words from that. What you just shared is that awareness, communication, and support. So thank you so much, Dr. Kiriakopoulos. It's been a pleasure talking with you today. I learned new things today. I hope our listeners did as well. So thank you so much for joining us.
It's great to be here, and thanks for the opportunity to share.
Thanks very much.